Ndani ya Equity Afya tumekuja kumuona Tumbili. Tumesikia kwamba hakuwa na sikiti jana, and now we have decided to kuja tumuone ako vipi. Labda Tumbili ukoaje sasa hivi?
Niko better. Niko better, nashukuru God. Nashukuru pia daktari wa msaidia.
Kwanza pole sana.
Daktari anashughulikia vizuri.
Labda daktari anaweza tuambia ni nini labda iliweza kufanyika?
Okay, so tuko na Tumbili huko. Yes, alikuja na some signs of fever with the throat pain na uchungu in the joints. Yes, and kwa very weak, so our team was able to attend to him from the nursing station to the doctor who was on duty, our resident Dr. Cosmas. And I picked in, so we have realized that just a normal infection, and he has been amepimwa lab, everything has been under control. He has received the first dose of medication, and we have put him on medication because it was severe tonsillitis, and recovering now well. Yes. So we are just checking the vitals, tuone pressure iko sawa. Tujue uchungu imeisha, so that we release him for follow-up at the kwake nyumbani. So we shall be doing home follow-up as we'll be coming for the IV infusion for 3 days.
So labda hii mmekuwa mmemweka nini sasa hiyo?
Oh, this is we use it as an IV line ya kumwekea dawa. So the medications we have to infuse directly because they have a shorter life of action. So ndio tumemwekea na
also ishaingia kwa mwili already.
Ishaingia kwa mwili already. Sababu tukimpeza kumeza anakuwa na uchungu kwa throat na ile sign ya vomit. So we want to not give him dawa ya kumeza, so that's why we have to do a IV infusion.
Labda hiyo infection inaletwa na nini yani?
Okay, just a minute. Let me try. The pressures are okay. So the infection is a normal occurrence. It's normally, from our investigation and examination, it's a bacterial infection. So inaletwa na normal bacteria ambazo ziko kwa environment. But similar symptoms can occur when it's a viral infection. Mambo, even during COVID time, you could present with the similar symptoms. But then we try to rule out from our symptoms and examination, we settled on a bacterial infection, what we call sinusitis and tonsillitis, which we are managing now. It is only that it was a severe form, tonsillitis grade 3. Ilikuwa imeanza kuform ile uzaa, what we call purulent tonsillitis.
So akitema mate anatema pamoja na uzaa na damu.
Ilikuwa hapo kidogo, si damu, ni uzaa tu kidogo. Just because the infection ilikuwa imekaa maybe siku mingi bila ku notice, that is why it's called purulent tonsillitis. Yes.
Tumbili sahi?
How are you feeling?
I'm feeling better. Compared to when I came, at least I'm getting strong.
Pole.
At least naweza mate kidogo. Najaribu kunywa supu. Ile siwezi kula bado. Nikiongea pia nasikia uchungu. But so far I'm getting better.
Pole. So labda daktari anaweza kula chakula kama gani kwa
It's okay. Once I'm quite stable and is able to swallow, he can take any food. But obviously, because of the infection, we have advised him from our nutritionist on those foods that can boost immunity. So mambo na ndimu, kutengeneza some fruit salad. So for now, because of the pain, kumeza, we want him to take some light meals. But once the throat iko sawa, he can take any other food ambayo angependa. So then tumemwadvise ile chakula ya boost immunity, because infection can occur to anybody, it occurs to us doctors, occurs to any other person. So it's so advisable even this festive season watu wakulele chakula ya kujenga immunity kwa strong, like hizo ndimu, mambo kama matunda, ginger. On top of that, watoto wadogo wapewe ile tunaita 7 C's na hizo zile immune boosters kwa watoto. Yeah, it's essential to prevent the infections from recurring. Yes.
So labda to expect anaweza toka leo?
Yeah, is stable.
Kuna show leo.
Tunataka
wacha mambo ya show.
Celebrate atafanya leo. I'm also a fan of his shows. They always encourage us to entertain. But for today, we'll hold him mpaka jioni hivi. Tukimrelease once ako uchungu imepungua kabisa, tunataka ende nyumbani apumzike. The next 3 days we don't want him to do a lot.
Daktari ni fan wa
Yes, I'm a fan of Tumbili. Hata sasa nilikuwa nimevaa nikuja kazi.
Nice one. Salimia KRG ukiwa wesi.
Kiariji ni mchawi. Nimeleta mambo yote. Kiariji upuga.
Sawa, pole sana Tumbili.
Tuko sawa. Thanks so much daktari.
Thank you to Equity Afya pia.
They responded so quick.
Our team of Christine ndiye alimwatendia wa kwanza.
Christine. Memona and I remembered she was attending Othul.
Yes.
Hospital.
Yes.
I used to take Othul there for medication.
The late
Yes, the late Othul. And actually she told me to Othul hapa mpeleka hospital ingine hapa tutatoboa. And when I removed Othul kampeleka KNH,
akasaidika.
That guy I give up. So it's we thank God so far. Thank you so much Equity Afya and the whole team. They responded well. I couldn't even walk. They pushed me the wheelchair.
Oh, hii wheelchair iko hapa.
Yeah. Well, so I was sick. I couldn't even talk. You know, it's been 20 years in Yonekana hospital, like me the patient. Though I'm always patient. So I'm always in the hospitals for my kids, and you know. But thank you so much, Dr. Onsongo. Are you related to Onsongo?
Comedian.
Yes, I'm related. We come from the same community. Nikiwa mdogo nilikuwa nataka kuwa comedian. Yeah, Onsongo is we are related because we come from the same community. But hatuko
for the first time at daktari alikuwa anataka kuwa comedian.
Ilikuwa kitambo.
Sasa
anataka kuwa daktari.
Tulienda audition ya Churchill nikafukuzwa. But ilikuwa kitambo.
Sasa comedian walikuwa wanataka kuwa daktari lakini mambo ikaenda
ikachemuka.
Ikakataa.
Pole sana Tumbili lakini.
Dr. Onsongo is the director here, if I'm not wrong.
Yes, I'm the medical doctor in charge of Kitengela branch and South B, the medical officer in charge. Yeah, Equity Afya pia tuko na familia kubwa. Tumbili has been our great friend. The other time alikuwa ameenda branch yetu ya huko.
Acha tungoje mwadhante hapo ugonjeke aende hiyo South B.
Nilipeleka hata na nilipeleka huko Obina
nilipeleka akasaidika.
But ni wapoa. Na sasa
anaona amesmile.
Sasa anaongea tukikuja huko hata anaongea.
Hata kulala usiku imekata. Inabidi ni watch movie hata sitaki.
Christine, unasema aje?
We thank God Chris Duncan is doing well.
Mgonjwa msumbufu.
Hapana, si msumbufu
Duncan.
Ameendelea vizuri. Bila alikuja he was so weak, very weak actually. So saizi nikimuona hivi madaktari wamemshughulikia, tume up and down. It is our we feel so great whenever we see a patient talking na alikuja akiwa vibaya. So the team at least we've done our part. So
na maybe before nisahau, now courtesy of Tumbili for this festive season, I will advise some of our members at the general public in regards to ulcers. The other day we were in a Hope FM trying to speak about this, and it's good I mentioned the aspect.
Yeah, sure.
As we approach the festive season, it's good we take care of our health. So because lifestyle diseases are diseases ambayo inaletwa not what Tumbili has. This is an infection. But there's what we call NCD, non-communicable diseases, which is not infection, and these diseases are brought by how we live, our lifestyle. Specifically of interest in this festive season is issues of hyperacidity and peptic ulcer disease, especially if people are not keen on how they are taking their meals, how regular their meals are, which kind of food they take. We are experiencing increase in these conditions, especially in our outpatient setup. So we advise mainly so many things, but in a summary, like we need to take our foods regularly. So if you are taking your lunch at 1, ensure you keep taking your lunch at 1, because in festive season people are prone to taking irregular meals, which predispose them to a lot of acidity secretion, which can lead to ulcers, especially for ladies. The other issue is avoiding cold foods. Chakula kile kimepoa kabisa. We try to avoid the spicy foods and those foods that are called acidic foods, like soda kwa wingi, kuchukua hizi
majuice,
majuice, yes, they increase your acidity. Then at times when you feel there's a abdominal discomfort for so long and you have been taking many drugs, it's good you visit an hospital, you do H. pylori test, because there are people who have been taking all types of drugs and kumbe ulcer inaleta na what called H. pylori organism. So when you do a lab test, na ujue uko nayo, you are given medications, it can be treated. But most importantly, prevention of acidity in excess. Once you are able to know how you live, and wherever this time allows, I know 2MBILI has a program in which is going to educate people through his programs on health segments, yes. But I wanted to mention that so that we know this festive season we need to take care of our health.
Thank you so much, Dr. Nsongo. Shukrani mwalimu.
Yeah, so umewambia services that you offer also. Wale watu nimeambiwa nitakuja kuoshwa masikio. That my masikio sisikii poa.
2MBILI was actually attended by our ENT consultant. So that means we have specialist services, we have general medical services and comprehensive laboratory services. On top of that, we do dental and optical departments. So our facilities are comprehensive outpatient care, and this is the same for all the 72 medical centers in Kenya today. So you can visit in and all your medical services are attended apart from inpatient and theater services. That's the only service we are not providing currently. So we have a pediatrician, daktari wa watoto, gynecologist kila Friday, daktari wa mama, tuko na ENT, dermatologist, ngozi, physiotherapy, hata sasa ako hapo full time to attend to people who have bone issues and muscle problems. And our lab is modernized, so that means immediately 2MBILI walked in, we send our sample to the lab and the results zikakuja immediately.
Hakuna ile kudelay sana.
Yeah, our TAT is normally minimized. We try to do as much we can. That's why we have even 2 nurses on duty during the day, 2 doctors. We have the resident doctor and I'm also there to cover up excess so that we reduce the duration taken in the hospital setting.
Mnafanya kazi poa sana.
Thank you so much.
Thank you too.
Karibu.
Umesahau kusema kwa na madaktari wameiva. Dungwa sindano ati. Mimi hata sijasikia nimedungwa.
Umedungwa na daktari ameiva.
Oh.